Hello everyone. Today we are going to be talking about Xanax. We will be going over the background information, drug effects, pharmacokinetic and pharmacodynamic factors, physical dependence, and abuse and addiction potential. The background is important as it explains how the drug got created in the most common names. Xanax was developed in the 1960s. The formula created showed a positive resolution for curing anxiety. It was synthesized and subsequently patented in the United States in 1967, which was later approved by the FDA on October 16, 1981. Since then, Xanax has become one of the most commonly prescribed medications for anxiety and panic disorders. Xanax is the brand name for the drug alprazolam, which belongs in the benzodiazepine class, which is important for later as it is the central nervous system depressant. Xanax is synthetically produced and is manufactured in a lab. It is commonly available in tablet and oral solutions. Here is an example of what the Xanax looks like when it is being synthetically produced. There are multiple different behavior changes found while taking Xanax. There are cognitive long-term and short-term effects, as seen on this image. Xanax is primarily prescribed for individuals who suffer with anxiety disorders and/or panic disorders. Xanax helps reduce the intense feeling of fear and worry, leading to calming effect on both cognitive and physiological functioning. However, it can also affect cognitive information processing like attention, concentration, memory formation, mood regulation, decision making. It may lead to tiredness and depression-like symptoms. Now, to go along with that, there are some short-term and long-term effects to taking Xanax. Short-term effects include impaired coordination, low blood pressure, difficulty speaking, increased libido. Long-term effects include drug dependence, drowsiness, fatigue, weight change, organ damage, heart and respiratory issues, and there are mental health issues including memory problems, depression, anxiety, cognitive decline, and mood swings. There are pharmacokinetic factors such as administration, bioavailability, absorption, distribution, metabolism, and the half-life of Xanax. Now, to start off, we will talk about the administration, and the most common way that Xanax is administered is orally. However, there are two ways that it can be taken. It either comes as a solution that you put liquid drops into your mouth or as a tablet. Once it is administered, there is a rapid absorption through the GI tract. There is little absorption in the stomach, so most of it gets absorbed in the small intestine. The highest peak of plasma concentration is on average anywhere between 1 to 2 hours. After it gets absorbed, it gets distributed through the central nervous system. During distribution, 80% of the drug attaches to the proteins in the bloodstream. The most common type of the protein that it binds to is called albumin, meaning around 20% of the drug is free in the bloodstream, which is the part of the distribution that is affecting the brain and mental aspect of the behavior. Now, to go along with that, the bioavailability of Xanax ranges anywhere between 80 and 100%. Effects can be experienced within 10 minutes of taking the drug and can last anywhere up to 6 hours. Since most of the drug gets absorbed, it leads it to being highly bioavailable. Now, to go off of the bioavailability, a drug's half-life is the time it takes for your body to eliminate half of the dose. For Xanax, its average half-life is 11 hours, but it can range anywhere between 6 to 27 hours. This range is dependent on a lot of different individual differences. Now, here is an image of Xanax's half-life. You can see after 11 hours, the concentration goes down and so forth. Now, these individual factors that influence the half-life include age, liver function, weight, metabolism, dosage, and frequency. Xanax is metabolized in the liver by CYP3A4, which, when Xanax binds to proteins, the drug can act as a reservoir, which prolongs the effects over time. After Xanax has been completely metabolized, it is filtered out by the kidneys and excreted through being in urine. The pharmacodynamic factors section will focus on how Xanax affects the brain and nervous system. This includes neurotransmitter systems, how Xanax is an agonist, and the effects these things can cause. The neurotransmitter system that is involved in GABA, which depresses the central nervous system as it is inhibitory properties. It is what naturally causes the feeling of tiredness and the calming effect. This makes the central nervous system depressants useful for anxiety and sleep disorders, which is what Xanax is used for. Xanax increases the activity of GABA at the GABA receptor, which acts as a central nervous system depressant. Now, Xanax strongly binds to the benzodiazepine receptor, which activates them. When Xanax binds, GABA and Xanax bind at different locations, influencing the GABA binding. It is high affinity agonist, so Xanax binds very tightly and easily. Because GABA and Xanax bind at separate locations, it causes an allosteric effect. An allosteric effect means that there's an increased action at the GABA receptor, causing an opening of chloride ion channels in the neuron. This hyperpolarizes the neuron, leading to a decreased chance of firing and action potential, causing the calming effects of Xanax. Xanax is associated with increased dopamine levels in certain areas of the brain. These areas are involved with motivation and reward, that is, the reinforcing properties of the drug that leads Xanax to being addicting. With repeated use, individuals can develop a tolerance to Xanax, and when stopped use, withdrawal symptoms may occur. With repeated usage of Xanax, this leads to individuals having a higher chance of developing a tolerance. They need more of the drug to cause an effect. As Xanax intake increases, this can lead to an increase in withdrawal symptoms, dependence, and addiction. Tolerance occurs when the brain has adapted to Xanax's depressive effect on the central nervous system, causing an overactivation when stopped. Now, there are two different types of withdrawal symptoms. There are normal, which include increased heart rate, blood pressure, temperature, sweating, anxiety, insomnia, hallucinations, severe cravings, overreaction, reflexes, agitation, shakiness, and seizures. While there are severe acute withdrawal symptoms that include mania, psychosis, depression, suicidal ideation, hallucinations, seizures, and convulsions. Now, to go along with that, abuse potential is a huge risk in many drugs. There is risk of addiction from the effects of dopamine. To define addiction, it is defined as feelings of strong urge to keep using drugs, even if it's only causing harm. As mentioned earlier, Xanax is associated with increased dopamine levels in certain areas of the brain. This increase of dopamine in these areas increase motivation reward. This leads to needing the drug to reinforce this behavior and wanting to do it again, which in turn leads to addiction. Here are the most common signs of addiction: taking more Xanax than prescribed, trying to get more Xanax from different doctors or buying it illegally, feeling anxious or stressed when you don't have Xanax, continuing to use it even when it causes problems at work, school, or home. If you or anyone you know is struggling, there are many resources to help you and help get treatment. I hope you like learning more about Xanax and how it affects the body.